everyone, welcome back to my YouTube channel. This is your psychological companion Bhavityagi. Basically, in today's video, I have a lot on my plate to tell you. So basically, in this video, I'm gonna tell you about main psychological concept. जैसे कि अभी मैंने एक recent psychological issue लिया है of most of the people. They are facing a lot of mental health problems. We celebrate our World Mental Health Day, which is basically for mental awareness and breaking the mental stigma which is circulating around our Indian society. Not circulating, even embedded in Indian society. Na? So basically, we celebrated our World Mental Health Day on 10th of October every year. So, what's our main aim? Is to spread mental awareness among the people, either irrespective of gender, irrespective of age. Okay, so it totally talks about your mental status, like how your mental age is. You also know na, that we have one chronicle age of how old we are physically, and one is our mental age. How old you are as your mental age means how mature you are as mentally or from your mind. So basically, what I face the current issues among the people that they are so prone to negative emotions, having the stress, having the anxiety, having depression, and they don't know how to tackle with such situation, such conditions. And most importantly, there is no psycho education around our society, in our society, in our world, which is very very important, and it's basic as your GK, as your general knowledge. Okay, because when you start understanding your psyche, when you start understanding your mind, your mental processes, like how your mind is working, on which phenomenon, on which principle, you are able to cope with so many mental illnesses, mental disorders. Basically, what happened, you can't change like natural stress which is occurring in your mind, which is happening in your mind, inside your body, inside your mind. But when you are mentally aware, like why this stress is happening, when you are studying psychology, then you are able to cope with that thing, है ना? You're able to, है ना, reduce your stress, your anxiety naturally. So that's basically help us. So what is the core idea here is basically to get know about psychology, to get engaged in psychology, to get aware of psychology, about aware of mental health, है ना, your mental health status, है ना, what your status is, like आपका mental status क्या है, आप mental level पे कहाँ exist कर रहे हो. Like there are so many mental I can say psychological tests which are used to check your mental age. Versus have, as I told you, there are two types of age. Your chronic age, which is your physical age, जो कि natural है, वो बढ़ेगी time के साथ. But how mature you are mentally is basically seen by your mental age. No, it is calculated. So there are so many mental age tests conducted. You can conduct it on Google and then check your score. They will ask you some questions, है ना, out of like 30, 50, whatever, है ना. So there are some standardized tools, है ना, and assessments which are only able to conduct by a psychologist, a registered psychologist, especially like clinical psychologist, or your neurologist, basically at higher level if I say, or I can say your applied psychologist. Both are applied psychologist. Okay, and to be clinical psychologist you have to get registered with RCI Institute, है ना, and get RCI number. Then you are able to conduct your clinical practices. You can open your own clinic also after getting the registration number, or after getting registered as clinical psychologist. Now basically clinical psychologist deals with the diagnosis of mental disorders by doing assessment basically, and tells the people about like how to cope with such mental conditions, and then helps the people to cope up with various mental disorders like either it is stress, anxiety, depression, insomnia, and etc. So basically, this is, as I told you, psychology is a totally a pure applied science. Okay, it is totally a science. And one more thing, but as I told you, like there are so many cases in adolescents, in adults. What I have faced is they are so prone to uh, mental stress, mental depression, and such condition, and they are indulging in negative uh, lifestyles, routines, negative health, not means healthy habits, negative habits basically, like drinking alcohol, doing some kind of addictions, either phone addiction, it may be alcohol addiction, smoking addiction. For that there are also specialized psychologists which are known as rehabilitation psychologists that deals with particular such patients. Yes, in some case clinical psychologist can also do this case. Okay, and one more thing is because yeah, after that your counselors, your counseling psychologist, these are your general psychologist. As I am pursuing counseling psychology, they are basically deals with your general issues. No. If they become more severe, so then the case will handle to clinical psychologist. But if your counselor are so much, I can say, having the assets, like having the particular uh, I can say particular knowledge of disorders either. Okay, if they study disorders separately from themselves. Yeah, here the example of disorders book, which is classification, which is well established, studied by all psychiatrists and psychologists, is the DSM-5 classification. And after that the case, after that you are able to basically run your mental health uh, campaigns, mental health awareness programs as clinical psychologist, counseling psychologist also, and you can provide mental health services in different domains, in different areas, like especially in hospitals and clinics, and you can teach psychologists in school, either in colleges or universities as per your preference. But to get licensed, you need RCI approved license and to be clinical psychologist or a licensed clinical psychologist mainly in India. This is the specific criteria which we can say it is a limitation to be clinical psychologist in India, but it may be opportunity for you as well based on how you grab it. Okay, next is, like we have today takes the issue that is people are more prone to stress, more prone to anxiety and depression. Basically what have seen here is you have to understand that your mind and body are integrated and are interrelated. There's no dualism concept which was given by Rene Descartes is here not reliable, I can say. Neuroscience proved it, and you have to understand है ना. इसका एग्जाम्पल है, बेस्ट एग्जाम्पल योर साइकोसोमैटिक सिम्टम्स, and you are so much in psychological pain, either stress, so you will face some psychological symptoms also, like grumbling and doing है ना, your some natural body parts will automatically like scramble. Okay, so you will get to know, yeah, I'm somewhere in higher anxiety and in higher psychological pain, and such condition are found in stress basically. If you are more in depression, so that is low persistent mood disorder, so in that case you are not see such condition, but your pain is higher inside it, so it is more like anxiety may you get some symptoms, but if depression to get to know that someone is facing depression symptoms, it's more hard for common people, but psychologists can understand it. So these are basic, but I have told you overall. First to understand your digital wellness, what you have taking from digitally, है ना, taking from digital है ना, from media, remember it. दूसरा है do deep breathing, box breathing in case of higher stress, like which is 4 4 4 4. Now 4 4 inhale, then 4 4 hold, then 4 4 exhale, and then 4 4 repeat cycle, as it is a cyclic process. And then what I have told you, to maintain your screen time properly and to avoid screen, है ना, 10 to 15 minutes before sleeping, है ना, because that will break your sleep cycle, your cardiac rhythm cycle basically, है ना. You will not get to sleep naturally. That will also then further leads to depression. And also take balanced diet. Also keep focus on your diet, because sometimes we forget diet. We talk about sleep, we talk about cardiac rhythm cycle, we talk about digital well-being, but we forgot one more aspect, that is our diet play a very crucial and primary role in our mental well-being. Because कहते हैं ना कि किस तरह का फूड आप ले रहे हो वो डिसाइड करेगा कि कैसा खाया अन्न वैसा रहेगा आपका मन. दैट विल डिसाइड कि कैसा आपका माइंड होगा ना. अगर आप हेल्दी फूड ले रहे हो तो विल माइंड भी हेल्दी, और अगर आप जंक फूड बॉडी में भरे जाओगे तो आपका माइंड भी कैसा हो जाएगा, जंक हो जाएगा. ऑलवेज रिमेंबर दिस, है ना. Somatic, as I had told you, and mind body are integrated. So, and neuroscience and everything also proved it. So always remember to, as I told you, that your body is like a temple, and it also resides your brain. To keep it with diligence, and keep it safe. Okay, and keep your body and mind healthy overall. Okay. Actually, I've talked about mental well-being today and body, also including the psychosomatic symptoms. Wow. Now let's. In last, I only want to give you one advice, that if you are facing any stress or anxiety or depression issues, it's okay that you will use some temporary fixes to fix such situation or conditions, but don't forget to consult doctor or psychologist. ना, जस्ट आस्क फॉर हेल्थ, नेवर गेट एफरेड. बिकॉज बहुत सारे मैंने देखा मेंटल स्टिग्मा आई हैव टॉक्ड अबाउट, बहुत सारे लोग ऐसे आज भी केसेस हुए हैं यहाँ पे मेंटल, बहुत लोग अभी भी इल हैं. अगर उनके बच्चे होते हैं तो वो उनको कहते हैं कि तुम मेंटल कंसल्टेशन मत लो, और लास्ट में क्या होता है, बच्चा दे सुसाइड आइदर, दे विल किल दैम सेल्फ आइदर ना. तो दैट इज़ द मेंटल स्टिग्मा दैट स्टिल एग्जिस्ट इन आवर सोसाइटी. तो गेट योर वॉइस रेज अगेंस्ट सच मेंटल स्टिग्मा. Okay, bye bye, take care.